name is Pranitha and I'm the speech pathologist that visited your father at Claremont Aged Care.
Hi Pranitha, I'm Tasman.
Nice to meet you.
Nice to meet you.
How are you going today?
Good, alright. It was a long flight from Western Australia, but
Oh wow, I'm so grateful that you're here today.
yes, I haven't seen my dad in quite some time now because the distance is just too big and I have a very busy work life, so it's been very difficult, but I'm glad he's been looked after here, or I hope he's been looked after here.
Yeah, I had a visit at the aged care and they're definitely taking good care of your father. You have nothing to worry about.
Oh, that's good. I'm just really worried because I've heard that apparently some elderly people can have trouble swallowing, and I'm just really worried about that because I've read a lot and it sounds very serious, and I hope that they're taking the time to actually feed him properly if he's going to be having trouble.
Alright, so your concerns are definitely valid, and from my visit the other day at Claremont Aged Care, your father seems to have no problems with swallowing, which is great. He is quite capable of swallowing his food without coughing, meaning that he's not aspirating or anything's going to his lungs, which is great.
Oh, what's aspirating? I didn't come across.
So aspirating is when you end up choking on your food and it goes down to your lungs.
Oh.
And you start coughing quite severely.
But he's not
doing that, which is really
that's
great.
Good.
Yeah, and in terms of his communication, he's quite alert and his communication skills are really great. He's able to hold a conversation. His language is also quite proficient.
Oh, that's good.
He didn't have any word finding difficulties, which is great. He also made appropriate word choices and his vocabulary was quite sufficient, which was really great. So I have no concerns there whatsoever, and even his social communication skills were really great. He was doing turn taking, and his facial expressions show that he was engaged in the conversation. If we look at his speech, it was quite intelligible, meaning it was understandable, and I had no difficulty understanding what he was saying. And in terms of fluency, he didn't have any stutters, which is great. He also didn't seem to be struggling to get words out.
That's good, because he's always been a big talker, so
yeah, definitely.
That's good to hear.
Yeah, that's great. And in terms of his voices are very clear. His pitch was within normal limits, which is great. His volume tended to be on the lower side, but it was still quite normal.
Okay.
So he seemed to mumble a few times, but when asked to repeat, he repeated it a bit louder.
Okay, so do we need to do anything about that? Is that...
Well, it's not an area of concern, so I'd say that it's quite okay.
Okay, so I'm a little bit worried about him getting dementia or something like that because he is in his 90s and I'm just really concerned about him forgetting things and,
Yeah, definitely. I understand your concern. And at that age, things like dementia can occur. However, that's not really my area of expertise, but all I can say is in terms of dementia care, there are a few tips that you can follow. Some easy, really simple tips. So one is stating your message clearly.
Okay.
Another one would be to break it down. So when you're saying something, to really simplify it and make it easy as possible for them to understand.
So if I have like 3 things to tell them, I should just do it sort of one at a time?
Yeah, one at a time,
Okay.
and using really simple language. The next thing would be to show affection. So it can be quite frustrating, if they keep forgetting things, but it's important to always make sure that they're not doing it on purpose. It's not their fault that this is happening to them. Another one is to make sure that you get their attention by, tapping them on the shoulder and making eye contact with them. Another way is to ask simple questions. Ask one at a time. Another tip would be to promote a really positive mood. I try not to yell at them as well because, they really need the support. Another tip is to reminisce and not remember. So don't keep saying, oh, don't you remember this? Don't you remember that? Try say, oh, let's reminisce about the time when, and then.
Okay, yeah.
And finally, just say, they tend to go off topic and they're speaking about something that, you didn't ask about or something completely random. So you just politely need to redirect them into the conversation.
Yeah.
So there is, I would say, 8 tips that would really help when speaking to someone with dementia. So, just keep this in mind.
Okay,
I'm sure your father will be fine. He's quite healthy and quite alert. For now, you have nothing to worry about.
That's good.
Great. Thank you so much for your time today.
Yes, thank you very much.
I'll see you another time.
Yes.